Hi guys, welcome to Dr. Kala. In this video, we are going to see about sickle cell anemia from oral pathology view. We also discuss about the clinical features and all also. So, uh, do see the video till end and do subscribe to our YouTube channel if you have not yet subscribed for such amazing content. So, let's just begin. Sickle cell anemia, as you know, the sickle cell anemia is a hemoglobinopathy which is caused by point mutation in the beta globin gene. Point mutation in the beta globin gene. So that leads to formation of hemoglobin S, which polymerizes under deoxygenated conditions, causing red blood cells to form sickle shaped. It causes RBCs to turn into sickle shape. Okay, the point mutation in beta globin chain leads to which is the main reason for production of hemoglobin S, polymerizes under deoxygenated conditions and causes RBCs to turn into sickle shaped. So these sickle RBCs result in hemolysis, vaso-occlusive pain crisis, and endothelial damage. So sickle cell RBCs are rigid and less deformable, as you can see the image here, which causes vaso-occlusive pain crisis, hemolytic anemia, and endothelial injury and damage. Okay. So let's see the pathophysiology behind it. So the pathophysiology involved is a single point mutation, and we have discussed it. A to T substitution in the first exon of the beta globin gene, converting the glutamic acid into valine. Okay, the defective hemoglobin tetramers are formed, which are hemoglobin S, which polymerize under deoxygenative conditions. This causes RBCs to form sickle shape. We have seen that. These sickle shapes are rigid, less deformable, and their lifespan is 10 to 20 days. What is the lifespan of RBCs? Comment down in the section below and let me know the lifespan of normal RBCs. The lifespan of sickle RBCs is 10 to 20 days. The rigid sickle cells, as you know, hemolysis and all, they cause. We have discussed it previously, right? Then, patients have hemolytic anemia, of course, and these sickle RBCs and leukocytes adhere to the vascular endothelium causing vascular obstruction and tissue ischemia. The chronic inflammation with an increased risk of thrombosis is an event which occurs in this vaso-occlusion, and the immunocompromised individual due to autoinfarction of spleen or surgical splenectomy so have hypercoagulable state based on thermoelastographic profiles. Then coming to the clinical features, as you can see the patient here. So the clinical features include stroke, acute chest syndrome, priapism, multi-organ failure, splenic or hepatic sequestration. Splenic or hepatic sequestration, how it occurs is if cerebral infarcts form, they lead to stroke of brain, which leads to mental retardation in the patient. If pulmonary infarction, that is, if the infarction is in lungs, okay, then they lead to pneumonia, okay, and splenomegaly, enlarged size of spleen. This causes splenic atrophy or autosplenectomy. Then retinopathy is seen, cardiomegaly, when the cardiac muscle is enlarged. It causes congestive heart failure, polylithiasis, and renal infarcts. If the infarcts are in the kidneys, it leads to hematuria. Okay, infarcts in the extremities may be seen, bone marrow hyperplasia may be seen, and aseptic bone necrosis. Aseptic bone necrosis because since the oxygen supply is decreased in the patient, there is decrease in the oxygenated blood to all the parts of the body. If that is affecting the bone, then it causes aseptic bone necrosis, which might lead to osteomyelitis, and ulcer and vaso-occlusion may also be seen in the patients of sickle cell anemia. Then coming to the symptoms that patient presents with are jaundice, fatigue, dyspnea, infection, pain and swelling, and organ damage. Then coming to the transmission. How is sickle cell anemia transmitted? It is a autosomal recessive gene inheritance pattern. This is important. Please make a note of it. Autosomal recessive gene inheritance pattern is through which the sickle cell anemia is transmitted hereditarily. The variable genotypes include SS, SC, SB0 thalassemia, SB plus thalassemia, SD and SC, which are the common ones. As you can see this in this image, if a sickle cell trait is present in both the parents, then the offsprings. How will the offsprings will be? 1 out of the 4 will be a normal child, and 2 out of 4 will be with sickle trait, and 1 child is affected with sickle cell anemia completely. Okay, you have to remember this chart also. Okay, then coming to screening, how do you screen? So we have to screen for sickle cell anemia in a newborn as early as 24 to 48 hours after the birth. Okay, the methods which we use are gel electrophoresis and high performance liquid chromatography, which are the confirmatory testing which are performed after positive screen results. Then if the patient is positive for anemia, that is having low hemoglobin, low hematocrit, low RBC, and high reticulocyte. You know what is anemia positive. So you have to check whether the patient is positive for anemia, for hemolysis, for HBS, for inflammation, like we order CRP, erythrocyte, ESR, and all. So we have to check this in the newborn patient, newborn infant. So positive for iron studies if chronically transfused, and which is associated with increase in thrombin generation, fibrinolytic activation or platelet activation, increased antiphospholipid antibodies, decreased level of circulating anticoagulants and cofactors. So this all you should screen in the newborn. Okay. Then coming to the histopathology, which is the main important thing that we have to discuss in this video. Kupffer cell erythrophagocytosis is seen. Kupffer cell erythrophagocytosis is seen in sickle cell anemia. Hemosiderosis is present. Sinusoidal dilatation can be appreciated, and intrasinusoidal sickle red cells in quasi-inflammatory or uninflamed background is seen. So here are the sickle cells which are present. This is the most characteristic feature through which you can diagnose the sickle cell anemia. Okay, especially when given in examinations. Remember, the sickle cell anemia histology includes sickle cell RBC in the picture. Okay, then coming to the treatment, bone marrow transplant is the only cure now we have. Apart from that, there are other treatment options also, such as Volexter, which treats sickle cell disease in adults and children 4 years old or older. So it is an oral medicine which prevents RBCs from forming into sickle shape and binding together. Okay. Then crisanulimab TMCA is an approved medicine for adults and children 16 years older. So it is given through IV. It helps prevent blood cells from sticking to the blood vessel walls, causing blood flow blockage or inflammation or parenchysis. It decreases that in the patients of adults and children above 16 years. Then hydroxyurea is an oral medicine which shows reduce or prevent several complications in sickle cell. And FDA recently approved L-glutamine for people aged 5 or older, so which lowers the number of pain crises. Okay. Then penicillin taken twice helps children from having serious infections due to bloodstream. And newborn infants, we can give liquid penicillin. Older children can take tablets. Then acute transfusions treat complications with severe anemia. If the patient exhibiting severe anemia, he can be given acute transfusion, and red blood cell transfusion increase red blood cells and provide normal RBCs for the patient. And regular and ongoing transfusions should be performed in the patient to lower the chances of stroke. Then sickle cell trait. What is a sickle cell trait? We have discussed it in the inheritance, right? Sickle cell trait is an individual who is expressing a benign condition. Okay, benign condition when the individual is acquiring only one sickle cell gene and one normal gene. If two sickle cell genes are inherited, then sickle cell anemia. If only one sickle cell gene and one normal gene are inherited, then the patient is experiencing sickle cell trait. So they do not have symptoms usually, and they can live a normal life. Okay, there is no need of treatment since symptoms are not there. So patient leads a normal life. Then, coming to the question that was asked in NEET MDS 2023 was, a 10-year-old female child reported with episodes of hypoxia. Her HP was low. Histology shows the diagram as seen here. So, as you can appreciate from the histopathology, there is sickle cells in this diagram, right? So, hence, the patient is suffering from sickle cell anemia. If you like our video, do subscribe to our YouTube channel. You can also find us in all the social media platforms such as Instagram, Telegram, and our new WhatsApp channel also for more information and more updates regarding your preparations. Thank you.